Hello, everyone, and welcome to 3 o'clock with SOC. Thank you so much for being with us today. I'm just going to take a second to make sure those that want Spanish interpretation can get access to it. Buenas tardes, muchísimas gracias por estar aquí con nosotros en otro foro comunitario con SOC. Como siempre, ustedes pueden escuchar a través de una llamada de conferencia y hay que llamar 646-749-3122 y luego hay que introducir la contraseña, cual es 779-328-221. Thank you for giving me that time just to welcome on our Spanish-speaking neighbors. And again, please, throughout the time here, ask any questions in the comments. Let us know if you're here watching with us right now. Give us a little like, a heart, a smiley face. Say hello in the comments, whatever you want to do to let us know that you're here with us this evening. We have a great episode for you all today. We are going to be talking about all sorts of COVID topics, and then we'll also have a civic update and a critical update from Tammy for you all as well. So I'll go right into welcoming on our guest for today. We have Erica Olivier on here with us today, who is the interim. She's got a couple hats that she's playing right now. She's the interim deputy commissioner of community health and also the maternal and child health director with the Milwaukee Health Department. So we're really lucky to have her on with us today to be giving us some updates from the Milwaukee Health Department, and I'll welcome her on now. Hello, Erica. Thank you so much for being with us.
Hello. Thank you for having me.
Yeah. So we are really excited to get some updates from you regarding all sorts of COVID topics. I know people are always curious about this topic. So why don't you start first, though, by introducing yourself and letting us know a little bit about you and about the roles that you are currently playing with the health department.
Sure. So thank you for the introduction. I do have a very long title currently. Yeah. So my permanent role is the Maternal and Child Health Director with the City Milwaukee Health Department that oversees about 10 different programs that have to do with anything with healthcare access, family services, home visiting, doula services, safe sleep. So really honing in on any of the needs of our families, moms, babies, dads. We have fatherhood services and all kind of fun stuff under my hub. So that is my permanent role. As of July, I became the interim deputy commissioner of community health, which is one of the 4 deputy positions in the health department, really a hybrid of executive leadership and helping to support the pandemic predominantly right now. And, Office of Violence Prevention, as well as the Maternal and Child Health Division, amongst many other ad hoc tasks that come to light to support, the commissioner and the mayor and whatnot. So that is a very long and short synopsis of my role.
Yeah, thank you so much for giving us that explanation. And thank you for all of the hats that you're currently wearing to make sure things can go as smoothly as possible at the city level. So why don't we get right into talking about COVID cases then? Where are we at in Milwaukee? And if you have any specific information for the South Side areas of 53215 and 53204.
Sure. So currently in the city of Milwaukee, the number of positive cases that we've seen in total is 90,440 with a total of 703 deaths, and that's as of today. So the percent positivity rate for the city of Milwaukee is a 9.1%, which puts us in a category of a substantial transmission threshold. So really with transmission, that's, the person-to-person spread that we're monitoring to see, how rampant is COVID. And the positivity rate, if it's below 5%, that's the low transmission rate that we're trying to see. So right now we're still above it and, are really making that diligent efforts to get people vaccinated to hopefully see a change in that curve. In regards to any zip codes, specifically with 53204 and 53215, we do still see higher rates of transmission. But overall, there's definitely trends in regards to Black and brown communities, predominantly our Black and Hispanic or Latinx communities that do still have higher rates of COVID exposure in conjunction with lower rates of vaccines. So That is the unfortunate nature of it. But I will say, obviously it's not nearly as bad as it was this time last year, but we still are seeing a slight uptick as of late, and that, definitely correlates with the COVID variants.
Yeah. Thank you for sharing that. I was going to ask if you have any kind of comparison for where we were at last year. So good to know it's not as bad, but also
Right.
we know that getting into these colder months, things tend to get worse. So
yeah, we're definitely not out of the weeds quite yet, and the primary difference is that, we definitely learned a lot of things over the last year of all the mitigation strategies and how to access PPE and all of the, hand washing and all the stuff that we have in place. And in addition to the vaccines being available. So that's made a pretty big impact, because this time last year, the last I looked at the curve, it was 2 to 3 times higher of the numbers that we saw. So.
Yeah. So then what about vaccination rates? What are those looking like in Milwaukee?
Yeah. So in the city of Milwaukee, about 56% of our population is vaccinated, which is the percentage of a fully 2-dose or the 1 dose with Johnson & Johnson. And then the 2 weeks post vaccination, that we consider you're fully vaccinated. So 56% of our population in the city of Milwaukee meets that criteria. I do want to keep in mind that about 14 to 15% of our population are children that are under 12. So I'm curious to see, once things will come down the pipeline of having a vaccine available to that population, what that could do. Because obviously with the utopian goal of the herd immunity, that 80%, that is a factor that if the adults aren't as high, then what could the children do to help improve those statistics? But again, the largest disparities are with our Black and Hispanic or Latinx communities in the vaccination rates. So really want to target those populations and nooks and crannies all over the city, and making sure it's accessible, and making sure that, they're getting any kind of education and information that they need, support with transportation, whatever it takes to get them there, because it's really imperative and it's hitting our population the most.
Yeah, absolutely. What are some of the major vaccine locations that maybe are walk-in or easily accessible to people?
Yeah, so I will start with our City Milwaukee Health Department locations. So we have the Southside Health Center, which is 1639 South 23rd Street or 23rd and Mitchell vicinity, as well as the Northwest Health Center that's off of 76 and Mill Road. And both of those locations are open Mondays and Fridays, 9 a.m. to 3 p.m. Tuesdays and Thursdays, they're open 12 p.m. to 6 p.m. And then Saturdays, 9 a.m. to 1 p.m. And that's walk-in, no appointments needed. So we want you to come on down. And we have the mobile vaccine clinics that are all across the city. So on our website, you can see any location that they're at any day of the week. So that can include community businesses, different events that might be going on. So a lot of these festivals or fairs, we definitely try to be present at, as well as, local churches and food pantries and anywhere that makes sense. And especially in those areas that we see the lowest vaccination rates. So any of those can be found. So the City of Milwaukee ones are specifically identified on our website for the Milwaukee Health Department. And I can, post the website or whatever makes sense. And then for countywide ones, the Healthy MKE website is the best conduit to locate those and really find something that's closest to you, that is in the hours that you need. We really are pretty fortunate that we have so many of our, healthcare providers and clinics and local pharmacies and surrounding health departments that are all hands on deck with making vaccines available. So it's a large scale effort.
Absolutely. And then are there any specific efforts going on with MPS right now to make sure students that are eligible, that they're getting vaccinated?
Yeah, so MHD is working with MPS of planning for, once we get additional clearance, to about the 5 to 11-year-old vaccine, but currently for the 12-year-old and up, but having child-friendly and accessible vaccine clinics targeted at MPS schools. And particularly for the ages of 5 to 11. Obviously, you have to wait till the Federal Drug Administration approves that vaccine. But right now, we're really trying to make sure that if we can have it in-house at the schools, that's just the best idea. Obviously all of the vaccine clinics that are available in the city are open with the 12-year-old and up as well. But that's definitely going to be the biggest effort. I think also once Pfizer, they're going to apply for the emergency usage of the vaccines for the 5-year-old to 11-year-old population this week. So ballpark, it takes maybe 2 to 3 or 4 weeks for FDA to, review and approve. And we're really hoping that come mid to late October, fingers crossed, that we'll be able to start vaccinating that age bracket, which would be, leading us into the elementary schools and opening that up too. So, but obviously that's contingent on the approval process. And, we'll continue to partner with NPS on maneuvering through the pandemic and also providing any guidance that they need. And, they've been really, really awesome thus far of adhering and if not going above and beyond some expectations and, doing what's in the best interest of our kids.
Absolutely. That's great to hear. And you said this week is when it's likely going to be approved for 5 to 12-year-olds, 5 to 9-year-olds?
So that they are applying for the emergency usage of it. Okay. So we'll hear in the next 2 to 4 weeks or so if FDA approves that. So it has to go through the vetting process.
Right.
Make sure, because the difference with this is that for the children's vaccine, for the 5 to 11-year-old population, it's 1/10 of the adult dose. So it's just, what does that look like? What does it look like from administration and all of that stuff? So just got to make sure, everything's copacetic first.
Absolutely. Absolutely. And then how are hospitals handling this Delta variant? And is there any new information about the Delta variant? Are there other variants coming out that are beginning to be concerning for, anyone in your institution or for healthcare providers as well?
So, yeah, I can speak a little bit on the Delta variant first, and then, how is that looking in the hospitals and clinics? So the Delta variant is the predominant strain in Wisconsin. So, there is, the alpha, beta, and gamma, but those aren't the ones that we're seeing nearly as much as the Delta variant. It is extremely infectious and spreading quickly, more than any strain during the COVID-19 pandemic. And, it's 2 times more infectious. And unfortunately, we're trying to get to a place where we're not seeing the rates of, hospitalizations and things like that. But, I'll get into with the hospitals of people that are unvaccinated versus vaccinated, which is really the trend that we're seeing the most. But,
right.
The longer that this virus sticks around, the more opportunity it has to mutate into potentially more infectious and deadly variants. So that's where we're trying to catch it before it can turn into something worse. And, we're already seeing that with the Delta variant. So, and specifically with it, it does cause more serious effects and illnesses in unvaccinated people, which is why it's so critical to get vaccinated, wear your mask, and, really try to reduce the spread of the Delta variant so that we can try to curtail it from turning into something worse. In regards to hospitals and clinics, again, data is suggesting that the Delta variant may cause more severe illness in unvaccinated people. And that's even meaning that some, medical therapeutics may have less effect on the Delta variant cases because of its unique mutations. We do see with our hospitals that the hospital infection rates are concerning, and there's various levels of, ICU bed accessibility across the state, but we are gradually seeing that that's starting to become more limited with the number of cases that are coming through. But again, the most notable trend is that those that are unvaccinated versus vaccinated are exponentially more likely to become hospitalized or suffer from serious consequences and even die from the COVID variant.
Yeah, definitely concerning. Is there anything else that you want to share that you think is important for neighbors to know?
Sure. So segueing back to the COVID clinic locations, we just launched the Milwaukee Health Department just launched our incentives for vaccines at the Southside Health Center location and the Northwest Health Center, where they're giving away the $100 gift cards for the first dose effective today. So please, come on down. I was very happy to see that there was a line outside at Southside Health Center. So, that's the local clinic in the 53204 zip code. So please spread the word, get people to come down and get it. And in addition, obviously, while you're down here, we're still open for operations as a clinic because contrary to popular belief with COVID-19, we did not stop all of our really important services and programs. So, obviously for the maternal and child health and any of our home visiting, our doulas, WIC, community healthcare access, safe sleep, fatherhood engagement, all of that stuff is still going. So, and we just restarted our immunization clinics as well. So it's appointment based, but for the other vaccines that our kiddos need, especially for school, we're open. So please, come on down. Only other thing I would say is we are doing, door-to-door campaigning and canvassing, again, in those neighborhoods that we see have the lower vaccination rates or higher COVID cases. And 53204 and 53215 are definitely some of the heavy hitters from our end, and really trying to provide direct service as much as we can, because again, we know that there's so many different barriers and reasons that people haven't gotten vaccinated and just need more information, and just hoping to keep making a dent in this pandemic.
Absolutely.
And lastly, I know it's National Hispanic Heritage Month. Yay!
Yes, we definitely we had an announcement for that last week. I think it was the beginning or the 15th of September. So yes, we're definitely excited for that.
Yeah, so I know we have a couple things coming down from the city of celebrating and honoring the achievements and contributions of our Hispanic champions and the community at large. So just wanted to put that shout out there.
Absolutely. And what better way to celebrate Hispanic heritage, but to make sure it continues by staying safe and getting vaccinated.
Yes, thank you.
I love the incentive that you all rolled out with for those $100 gift cards. And are those given right to the people after they're vaccinated?
Correct. So
awesome.
It is on site, so immediately distributed to you, and it's for the 12 and up population. And yeah, we are ready to go, and it's while supplies last. So we're hoping it'll continue as long as it needs to, but that's why we really want to urge people to come down here while this incentive is available. We really tried to tie it off of when the state was ending their incentives to keep it going. So we'll do it as long as we got the time and the money.
Absolutely. Well, Erica, thank you so much for being with us today. You've shared a lot of really important information with us, and we're thankful for your time. And I don't see any questions in our comment section right now, but if anything comes up for our viewers, don't hesitate to comment or reach out to us. We have communication with Erica, so we can ask anything that you all may be curious about.
Yes. Thank you so much for your time, and everybody be safe.
Yes, thank you. Have a great rest of your evening.
Bye.
Again, big thanks to Erica for being on with us from the Milwaukee Health Department, sharing tons of important information and announcing that there is a new incentive for the vaccine. So definitely take advantage of that and head to the Southside Health Center to get your $100 gift card if you have not been vaccinated yet. Go and get your first vaccine. And now we have a update or a critical update from Tammy that she has for us. So we can go ahead and share that now.
Again, thank you for being with us today. The critical update that I have to share with you is that yesterday was the anniversary of the day that Jason Clearman was taken from his wife, his family, his friends, and all of us. And SOC is committed to honoring his legacy and invites you to join in that effort. So what I'd like to do now is direct you to our Facebook page where you can see the dedication that we did for him yesterday, and also where we have the link to fill out the interest form for you to participate with us. So bear with me, right? I'm not from this digital age, but I'm going to try to share my screen. Okay. And then I'm going to my Facebook page now, or SOC's Facebook page. Here's our Facebook page. It's at SOCMKE, SOCMKE. While you're here, please like it so that you can get updates from us. And then yesterday's posting is here. And let me read it for you. It said, I shared the announcement we made when Jason passed, and then added this new message. So last year's announcement of his passing, and then this year. And it says, today marks a year Jason Clearman was taken from his adored wife, Angie, his children, family, friends, and our community. Jason served as SOC's former president of the board. His legacy will live on because we here at SOC are going to fulfill a promise I made to him prior to his passing to support the continuance of the Walker Square Farmers Market. And he founded and managed that market for many years. The other things that we're doing in his honor is we are facilitating the implementation of a bilingual English and Spanish beekeeping certification and master gardener training in his honor. We're doing this because we want to follow what he modeled so greatly for us, which is to live out daily what you believe. And if you were with us last year, that's what I said about him. He was concerned about the dying population of bees, the disappearance of them. And so whatever he believed, he enacted in his life. And he became a beekeeper and had a beehive and helped other people, because I've been talking to folks, and there's folks he had helped to do that. And, you know, he was concerned about the environment and green space, etc. And he became a master gardener and kept the garden. He cared about immigration, became an immigration lawyer. That's the way he lived his life. And we want to honor that with opportunities for you all to participate in those things and to challenge you all to live out your beliefs as well. We are also really grateful to partner with the Walker Square Neighborhood Association, who he was a leader of for a very long time as well. And they had a mutual adoration for each other. And we're partnering with them, and they're heading up a memorial event in his honor. Now, the tentative date is 1 month from the anniversary. I just share that. I hope to be able to confirm details with his family. But we're targeting October 22nd, so stay tuned for details, which would be a month from his anniversary. Now, if you want to participate in any of these efforts, the Walker Square Farmers Market, or helping or getting the beekeeper certification, or helping or getting the master gardener, or helping with the memorial, we have a link here. I'm going to show it to you so that you're familiar with it, where you can show your interest in honoring Jason. And so it just says, please fill out this interest form if you want to collaborate on activities to continue his legacy. And then we'll contact you with the next steps. You can always call us at our phone number, 672-8090, or email us at soc@socmilwaukee.org, or visit our website, www.socmilwaukee.org, to ask any questions. And it's really simple. You share your contact information, super simple, and everything's in English and Spanish. And then here are boxes you can check on any way you want to participate. So here's the statement. I would like to honor Jason's legacy by helping with the following activities. And you can check all the boxes that apply. So if you want to do one of them or all of them, you make your choice. So here is the box if you want to help with the farmers market. If you want to help or do the beekeeping certification, if you want to help or do the master gardener training, and if you want to help with a memorial event. And then, like I said, there's a tentative date there. If you have another idea of how you want to participate and honor his legacy, then there's another space here where you can fill that out. And so we encourage you, again, go to our Facebook page under the post that we posted yesterday with a dedication to him, press the link and fill out the interest form. And we together will continue to honor Jason's legacy. We send our prayers and hugs to Angie and his babies, his kids, his family, his friends, which we count ourselves as part of, and the community, which this was a huge loss for. Thank you, and I hope to see your interest form come in and that you would partner with SOC in doing this.
Thank you for that update, Tammy. And so the link to that survey is in the comments, so please fill that out and let us know how you want to honor Jason's memory and continue to celebrate him and his contributions. And now I do just want to share, we did get a lot of COVID updates from Interim Commissioner Erica, but we do have some other updates for you as well. So there is a state level reward, $100 reward for those that were vaccinated for the first time between August 20th and September 19th. So in the comment section, you will find the form that you can fill out to indicate that you got your first vaccine in between those dates, and then you will get sent your $100 reward. So that, again, if you got your first vaccine between August 20th and September 19th, you have the opportunity to get this $100 reward from the state. So fill the form out that is in the comment section. There's also a phone number that you can call to do it over the phone instead, if that's your preference. So both of those are, the link and the phone number are in the comment section to get your $100 reward if you got your first vaccine, again, between August 20th and September 19th. And then we did just hear that at the city level, Milwaukee Health Department is rolling out an incentive locally starting today that if you go and get your first vaccine, and I actually have an image for it here. If you go get your first vaccine, starting today, you will get a $100 gift card while supplies last. So we were told there was a line out of the door today at the Southside Health Center. So definitely head there in the next few days. If you have not gotten your first vaccine, please get it, and then you will get rewarded with this $100 gift card. So again, you can go to the Northwest Health Center or the Southside Health Center. It's on off of 23rd and Mitchell, and you can get that gift card. So please keep yourself and your family members and your other loved ones safe by getting vaccinated. Things are just going to get worse as these cold months roll in, and this is the best way to make sure you and your loved ones stay safe. I also have a civic update for you all. So last week was actually National Disability Voter Registration Week, and then actually coincides very closely to National Voter Registration Day, which is September 28th. So I just want to take some time to remind you all, one of the easiest ways to register to vote is by going to myvote.wi.gov. But before I take you through that, I do just want to share a short video that talks a little bit about National Disability Voter Registration Week and what it means and why it's so important to have a week dedicated to that.
For those of us with disabilities,
it can be a struggle
to have your voice heard.
One of the most important ways to be heard is by voting.
Visit your county elections department from September 13th through the 17th and September 20th for Get Out the Disability Vote Week, part of the National Disability Voter Registration Week. Learn how to register to vote, how to mark your ballot online, and how to use an accessible voting unit.
Learn how to participate
in Washington's political process.
Because in an election, every vote counts.
So I'm just going to share with you all a website that I've talked a lot about on the forum throughout the elections of last year and this year as well. Let me, hold on, I switched off my screen here. I'm just going to share my screen with you all so you can see this website. Again, it's myvote.wi.gov, and that is in the comment section for you all. But there's so much that you can do on this website. You can just look at your voter information. You can find your polling place, learn what's on your ballot, update information, and then, of course, register to vote. So on this homepage, you can see that there's information about when the next election is. It seems far away, but it's going to come up quickly here in spring of 2022. So you can start looking at information for that. And then if you have not registered to vote yet, you can do that now with plenty of time to spare. And this is one of the easiest ways to do it is through this website. It takes you through the process very easily. So you can just click register to vote up here in the tabs. And then it takes you to this page where you would just enter your first name, your last name, and your date of birth. And this is a good way to confirm that you're registered to vote as well and update any information that you may have. And just keep in mind that what they will ask you for in this process is for proof of residence. And one of the easiest ways to prove where you are residing is a Wisconsin ID or license. But if you don't have access to that, or it's not, it's been expired since before the last election, then there's other ways to prove your residence as well. And that can be a letter from any government institution. It can be a military ID. It can be a paycheck or a pay stub. Any important piece of mail would likely work. And if you have any questions about what you might need to prove your residence, you can reach out to us and we can help you through that process. But the website also does a great job of helping you know what you can upload to prove your residence. But again, the easiest way is through a license or Wisconsin ID. And so you can do this over the phone or through the computer. On the phone, it's easier because you probably have easier access to a camera and your images on your phone photos, and then you can upload it very easily that way. Otherwise, you can email those photos to yourself and be able to do it online through a computer. So again, if you have any questions about that process, please reach out to us. Again, National Voter Registration Day is September 28th, so let's push to have as many people registered to vote in the SOC district as possible by that day so that we can all vote, those that are able to, of course, in this April election coming up in 2022. That seems, like I said, so far away, but it will creep up on us very quickly. So that is the major information I have for you for the civic update. And I do want to, again, just remind folks that we have this other survey, in addition to the other one mentioned for Jason Clearman's Memorial. We have a survey for you all to let us know what you think of the forum and let us know any topics you want us to bring on. So I'll go ahead and share that video, and we will see you next week, Thursday. Thank you so much for being with us today, everyone.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.